Okay, so if we get started here, sorry about the delay. So I'm going to talk about joint ill and lameness in foals. As Alison kindly introduced me, my name's Jannah. I'd just like to acknowledge that Amy Williamson, who's one of the other surgeons in the practice, put together most of these slides, and I am presenting them with her gracious permission. So thank you very much to Amy. So I guess the question is, what is joint ill? Most of you guys will know the answer to this, but it's basically infection of the joint space, and it can involve a bone component too, so infection of the joint and the bone. In foals, it could occur secondary to a blood-borne infection, or it could be secondary to a wound or an intervention, and by that we mean if the horse had an intra-articular injection or something of that nature. So specifically in the foal, joint ill refers to infection that's secondary to blood-borne bacteria. That's the most common reason that baby foals will get one of these conditions. It is life-threatening in foals. It can be a real issue if it's not treated promptly, and it can have long-term consequences, particularly for, an athletic animal. So why does it develop in foals? Well, there's a few reasons. They are more susceptible to infection because they've got an immature immune system. They will have sometimes concurrent disease, so that means they've got something else in addition to the septic joint. And then also potentially bacteremia and septicemia. So that means there's bacteria in the blood, and septicemia means that the bacteria are causing a problem. So the bacteria are releasing toxins and they're making the foal sick. So as stated previously, they have an immature immune system. That means they're more susceptible to infections. And following on from that, it is really important then that passive transfer of immunity is ensured because the newborn foal doesn't have the antibodies to protect itself against infection. So that means that we've got to ensure that they get enough colostrum and that we're measuring the IgG so that foal's got a fighting chance against any kind of pathogens that it might encounter. Prematurity and dysmaturity are often associated with a poorly developed immune system. And then also a late-term disease in the pregnant mare can then be passed on to the foal. The foal might be septicemic from something like that. So these kind of foals, as I said, they often will have a concurrent disease. So that might be seeding the joint. So if you've got a foal that has pneumonia, it's got a bad umbilicus or it's got diarrhea or something of that nature, that's the kind of foal that you need to be really checking the joints because one will often follow the other. Sometimes even this disease process, it might not be super obvious. They can get a septic joint following a disease process that was either really mild or transient and it wasn't detected at the time, but it still seeded the joint. So in the young horse, the joints and the bones, they have a really high blood supply, and that's to support their rapid growth. But for this reason, because they have such a high blood supply, they're really at risk of blood-borne bacteria, then lodging in the small vessels and establishing an infection from there. So what are the types of joint ill? So we can have infection in the joint space, a bone within the joint can be infected, or the growth plate can be infected, and a lot of times we'll actually have a combination of those things going on. The clinical signs, so lameness is going to be the primary one, but this can sometimes be a bit tricky to detect in foals, particularly if they are like a weaker foal or they have already an angular or flexural limb deformity that makes it a little bit tricky to tell whether they're lame or whether it's just that they're lax or whatever they might have. The other things are obviously if they have a joint swelling. Foals will often be really sore if you actually touch the joint or touch the bone that's got an infection in it. So if you think they might have an osteo, if you put your thumb right on the bone where you think the infection is, they will react. unlike adult horses that often won't. And then often foals will have a fever if they've got a joint infection, whereas again, adult horses often don't have that. So what do we do if we find the lame foal? We make an assessment of how severe it is. Is it mild, moderate, severe, or is the foal non-weight bearing, i.e. it's not able to get up? Check the legs and the joints for any obvious swellings, any new deviations, so a sudden deviation that might reflect the fact that they've actually got a fracture or something of that nature, and take the rectal temperature to make sure it's less than 38.6 degrees, looking for the fever. Lame baby foals, like little foals, are basically septic until proven otherwise. It's really, really common. So generally you should get your vet out as soon as possible if you've got a lame little tiny foal. If it's an older foal and you can't find any of these really obvious things like swollen joints, fever, that kind of stuff, it's always reasonable to get your farrier out to check if they don't have a foot abscess or something of that nature. But in a little baby foal, probably best to get the vet first. So while you're waiting for the vet to arrive, it's probably best not to give it any medications, because things like bute, they're very quick acting and they're very, very potent. So they can mask how lame the foal is, and it makes it a little bit harder for us to assess what's going on. And then also it's probably a good idea to review the foal records, see if the foal had adequate IgG, see if it was sick before, and if any other treatments were administered to it. And also review the mare record so that you know whether the mare had any kind of issues or whether the foal was a difficult foaling or something of that nature. The diagnosis of a joint ill or a septic joint, it involves a clinical examination. Usually we'll take radiographs, sometimes we'll ultrasound the joint. We generally always take a joint fluid sample, and blood work can be really helpful too in foals. So the clinical exam is going to involve a lameness assessment, and also importantly in a foal, clinical assessment of the other body systems. So we're going to listen to the chest, check the temperature, evaluate the umbilicus. After Rosemary's talk, I'll be looking at its eyes, etc., etc. Radiographs are pretty much always warranted because, as I said, most of the time, or not most of the time, but often there'll be a bone component in the infection as well. I'm hoping this is going to play because this is a great ultrasound. So that's bad. That's a joint space full of fibrin, and that's a really, really obvious septic joint. So it's got all the floaty stuff, that's fibrin. The black anechoic stuff, that's normal joint fluid, and that's a joint that really is quite advanced and quite septic. So it's useful when we're trying to figure out, so in a joint like the stifle that's got multiple actual joint compartments, trying to figure out which one's infected, which one isn't, and sometimes we'll need it to actually get a joint fluid sample because it can be tricky in some small joints. Joint fluid, we have a look at it visually. If it's thick and cloudy and you can't read a newspaper through it, that's not great. If we're a bit suspicious of it based on what it looks like and the foal's clinical presentation, then we'll send it to the lab and we'll get a full analysis done on it. And then also what we can usually try and do is culture the organism that's causing that infection. That's not 100% of that. We don't always get the organism cultured out, but if we do, then we can test various antibiotics against it and see what that foal, what the infection might be susceptible to. And blood work is usually obtained to just assess if we've got any systemic disease. And the markers of inflammation, if they're elevated, like fibrinogen, SAA, that might indicate an early bone infection as well. There are some alternative lameness diagnoses. The joint ill thing is probably the most common. Alternatives may include abscesses. They can present really weirdly and they can get abscesses everywhere. They can get infections along the spinal cord, or that's a possibility. Infections in ligaments, fractures obviously, and then anything related to the foot. So foot abscesses, but they can get infections within the structures in the foot as well, like the navicular bursa. So treatment, usually a combination of local and systemic therapy. We always like to lavage the affected joint space. It just means we just run a whole lot of sterile fluid through it. That's pretty critical in terms of treating septic joints. You can do it with an arthroscope, which is generally our preference, or a cannula, or just with a needle, depending on financial considerations as well. Putting the scope in is generally better because you can actually see whether there is infection eroding through the cartilage into the joint. If there is, you can debride it, and also you can actually grab those strands of fibrin and pull them out because the bacteria like to hide in them. So if you don't get them out, you've got a harder time trying to treat that infection. We also will follow that up with antibiotics. They can be the IV antibiotics, oral antibiotics, and then usually we'll either inject antibiotics into the joint or we'll do a regional lymphofusion with antibiotics. Some foals will need a repeat flush. That's not uncommon, particularly if you've got a large joint or the infection has been going on for a while before it was treated. Monitoring a response to treatment involves lameness assessment. So that's the number one thing, is the foal getting sounder. Also, we can follow up with joint fluid assessment. Are the joint fluid parameters improving? Blood work is also helpful. I guess this is something where the lameness assessment, we have to be very careful with how much bute foals get because they're very, very sensitive to it. So if they have a small amount of bute even, that can make them much sounder than what they actually are. And you think you're winning when you're actually not. It is sometimes worth repeating x-rays, 4 to 7 days after the first set. There can be some radiographic changes that you just can't see yet. So if you take them, a week or so down the track, you might be able to see something more obvious. Or if you've got a tiny spot on the x-ray you're worried about, take another x-ray in a few days and it might have become more obvious at that time. Complications, so I guess the main one would be ongoing or recurrent joint ill, so we just don't get on top of it. If it spreads to the bone, that's more difficult to treat, and then if it spreads to different sites, so that's what is often an issue in septic foals or compromised foals, is that they'll have a septic joint in one structure and then it'll go to another joint. That is an issue. So long-term, most of them do pretty well, but long-term complications can include some joint swelling, like joints that are not infected anymore, but they're just kind of puffy. And we can usually manage that to a certain degree, but that does happen. And lameness secondary to the development of arthritis. So if they've got a lot of cartilage damage, they might develop arthritis and then be lame sort of chronically because of that. So the outcomes for survival and athletic performance are actually pretty good from a joint ill. The prognosis for survival with appropriate treatment is around 80%. So that's around 80% of foals will get out of the hospital. This is reduced in foals that are less than a month of age. They're a little bit tougher. And also, as I said, if they've got multiple sites of bone or joint infection. Other things that might affect their prognosis are if they've got another body system that's diseased, so if they've also got pneumonia or diarrhea or something else on top of the joint ill, and salmonellosis, which is can just be a real bear to treat. This is a paper that was published last year by a former intern at Scone Equine Hospital, Tom O'Brien, and also two of the surgeons, and Joan Carrick. This paper is basically describing the survival and the racing performance of a large group of foals with septic arthritis compared to their maternal siblings, and all those foals came out of or were treated at Scone Equine Hospital. So of the 114 foals that were admitted between 2009 and 2015 with joint ill, 80% or 78% were discharged from the hospital. And as I said, the ones that were less than a month old or the ones with concurrent disease, they're about 5 times less likely to get out of the hospital. 2/3 of those that were discharged alive started in at least one race, and that's comparable to their maternal siblings. That's basically what your odds are of any young racehorse starting a race. And there was no ability or no difference in their ability to win a race compared to their maternal siblings if they got out of the hospital. So the conclusion of that paper was that foals treated for septic arthritis, they've got a good prognosis for survival, and if they do survive, they've got a similar ability to race as their maternal siblings. Any questions?
Do you find that some years are worse than others for judgment?
Not really specifically joint ill. I feel like there are some conditions that we see more often in dry years or wet years, like eye stuff, colic, but I think that joint ill tends to be pretty similar rates. Yeah. You will find that if there are some farms that see a lot of joint ill and some that don't see a lot of joint ill. And I think a lot of it is to do with that foal's immune status. So if the farm is particularly vigilant of making sure they get colostrum, making sure they pass their IgG, those foals are much less likely to come in with a joint ill. That seems to be a major factor. And then the other thing in terms of getting them out of the hospital is how early they come in. So if they've been sitting on it for 3 or 4 days, those ones are harder to fix.
As a percentage, how many of them do you think are prim or really overdue?
I don't know, honestly. I think it's not so much the pre or dysmaturity so much than whether they're septic or whether they're sick or bacteremic. And there's obviously a link between those two things, but it's kind of an indirect link between prematurity, dysmaturity and joint ill. Has to be some bacteria somewhere. Yeah. And it's really not, I think there was a lot of thought back in the day that most of these infections came from the umbilicus, and that's why it's so important to disinfect the umbilicus. And that certainly is true, they can come from the umbilicus, but more often than not they actually come from the gut because the foal's gut is leaky, like it has porous walls because it's very close to blood vessels. That's how they absorb their IgG. So the bacteria can get out and into the bloodstream from the gut a lot of the time. So that's why sometimes foals that seem perfectly normal, have a normal umbilicus, they can still get a joint infection. Yeah.
So should you separate the joint ill foals from the other foals? Like is it?
No, it's not necessarily transferable unless it's something like salmonella. Sometimes it is frustrating because we're trying to culture whatever bacteria it might be in the joint, and either we don't find out what it is, or it takes 4 or 5 days to grow it out. And by that time, if it is salmonellosis, there's probably been a period of time where it could have been, spread to other foals. But most of the other ones are not really spread so much from foal to foal. They come from the foal's own enteric bacteria, usually. Yeah. All good?